Welcome to Eye on America. I'm Michelle Miller. Today we examine both physical and mental health challenges facing Americans and meet the people trying to improve their lives. In New York, we visit a community garden in the Big Apple that's providing immigrants with healthy and culturally familiar produce. And in California, we take a closer look at the growing demands of a generation of adults taking care of both their young children and their aging parents. But we begin in Pennsylvania, where a unique sleepaway camp mixes traditional summer activities with therapeutic support. Camp Mariposa is a national year-long mentoring program providing children with tools to navigate addiction in their families. Nancy Chen visits one of these camps designed to break a potentially devastating cycle of addiction.
You're looking for the emotion embarrassed. Go, Cole, go.
With the sights and sounds of summer, this may feel like a storybook camp.
Green and purple.
But these children say their stories are far from it.
I never knew anybody else who had the same kind of experience as me before I came here.
It's Madison Timmons' third year at Camp Mariposa, a national year-long program that teaches kids the tools they need to manage addiction in their families.
What are some of the things that you remember about your dad?
I remember one time he showed up at my school and I thought he was just like having fun, but I later learned that he was just like, he was intoxicated. I was in preschool at the time.
Think about like if it was a play.
Traditional camp activities are combined with support sessions led by trained professionals. The focus, preventing drug and alcohol use.
Confident.
3,500 campers have come through the free program since it started in 2007.
Come on, Evelyn!
Renee Mazier is the director of this camp in the Pennsylvania woods.
We're teaching kids not only what addiction is and that it's a disease and how substances really hijack the brain, but then we follow that with coping strategies.
And it works. A 6-year study found at least 94% of participants, 12 years old and up, had not gotten high.
Let's go, Sonny!
Kids attend camp here between the ages of 9 and 12, what experts call a key window in understanding and breaking the cycle of substance use disorder. Children of a parent with a history of addiction are between 4 to 8 times more likely to develop a problem with addiction themselves.
My addiction has nothing to do with the way I feel about Madison.
Jason Strecker is Madison's father. He says he's sober today from the hard drugs he started using at age 12. His addiction strong enough at times to come before his daughter, the one whose name is tattooed on his neck.
When we talked to Maddie, she said that she feels like she's lost a parent, that she became an adult too soon.
Absolutely. It sucks because I didn't want it to be like that. We were really a strong family unit, and I thought I was going to be able to get it this time, and I really, really did, and then I started using again.
What is not working?
Immediate access to treatment.
Dr. Barbara Schindler is the medical director of a program at Philadelphia's Drexel University for families struggling with addiction.
Given how intergenerational addiction can be, how difficult is it to break that cycle?
It's a very treatable illness. This is a pediatric disease for almost everybody.
This summer marks Madison's last here as a camper, but she plans on returning next year as a junior counselor.
What would your message be to other children who are going through what you've gone through?
You'll make it.
A new chapter in this story for the next generation.
We continue with the addiction crisis and explore a possible and controversial solution to the epidemic. Harm reduction is a philosophy that focuses on preventing overdoses and minimizing the consequences of drug use instead of pushing abstinence. The practice has attracted passionate advocates as well as concerned critics. Mark Strassman drops in on one community that has fully embraced this approach.
An Indian is an Indian, a brother is a brother, a sister is a sister.
Twice a week, Coleman Cox drives more than an hour into controversy.
30 shorts.
30 shorts. Today we are headed to Veneta, Oklahoma.
It's called harm reduction. Its focus, preventing drug overdoses and the spread of infectious diseases rather than urging abstinence.
Across the board, this 7,000 square mile reservation, no one's immune.
Chuck Hoskin is the principal chief here with roughly 140,000 tribal members.
There's something that's especially sad, even pathetic about this, isn't there?
No one sets out to really get addicted to anything, but so many people were using this medicine because it was prescribed to them.
America's opioid scourge is a special sorrow here on the reservation. In 2022, more than 100,000 Americans died from overdoses. Native Americans are twice as likely to overdose fatally as white Americans. Cox and Chris Rich set up their van in an alley and waited for people with addictions to show up.
We have sterile syringes that we call them points.
Points are needles, clean ones for people using.
This is the controversy. It can be, yes.
Harm reduction programs have also been tried in dozens of communities. In several states, needle exchange programs were disbanded. Critics complained they encouraged homelessness.
It's easy to be unsuccessful because it tends to be just blanket approaches.
Cassie Abbott-Eng has researched harm reduction programs at the University of Tulsa.
Is this an approach born of desperation?
I would agree with that.
We met Donald Cody in Veneta. Now 61, he has struggled with addiction since he was 17.
I'm so tired of doing the same old thing and expecting something different to happen.
What do you think of the van program?
People are going to do what they're going to do, and that way they have the safest way they can.
So we were talking about the contract. Cox, now in recovery himself, agrees.
When people say to you, you're just enabling users. I am enabling them. I'm enabling them to live tomorrow. All my enabling leads to them eventually making the decision to change their relationship with their drugs. And then we can begin to talk about treatment and recovery.
As a tribe, the Cherokee fought opioids by suing multiple drug makers and pharmacy chains. They've won more than $100 million. Some of that money funds this harm reduction program.
I learned a Cherokee word today. Oh, you did? Gadugi. Gadugi, working together as a community, as a tribe.
And that's what this program is?
But it's also Uwe Shua Donatela, which means the ones who help from the heart.
This drum circle celebrates Cherokees trying to stay clean and sober. Handing out clean needles is sobering, but nothing else has worked.
Coming up, how one chef is cooking up healthy food and fun to inspire better eating habits. This is Eye on America. Welcome back. Ultra-processed foods have become a staple in diets across the country. Almost 60% of adults say they turn to these products for convenience, according to a recent survey. But these foods can increase the likelihood of developing diet-related diseases later on in life. Adam Yamaguchi meets one Chicago chef whose hands-on workshops teach kids and families how to boost nutrition at home.
Crust is caramelization.
Whether he's serving up the many varieties of French toast at Chicago's Batter and Berries restaurant,
Blueberry, strawberry, caramel, and lemon.
Filming cooking classes in his home kitchen,
So today we got fish and a mystery fish.
or showing families how to adapt those recipes at home.
Hello, 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 hello. Welcome back for another fun-filled segment of Let's Eat Right.
Chef Ken Polk mixes humor and nutrition science to infuse cooking with joy.
You can chop it, you can chunk it, you can think it, you can thunk it. It's all going right in here.
In a church basement on Chicago's South Shore, Polk works with the University of Illinois Chicago to change the food landscape.
Cooking is about hearing, as well as feeling, as well as smelling. If anybody in the room has a question, please ask, because the more you know, the more empowered you are, the better off your life will be. Ta-da.
In this neighborhood, food insecurity and rates of diet-related death are about 50% higher than the city average. Professor Saria Lofton says lack of food options is partly to blame.
And so you'd have a lot of convenience stores that had highly processed foods.
And the health outcomes that you were seeing in those communities look like what?
Well, we have higher rates of hypertension, higher rates of diabetes, cancer rates.
Each participant in the university's Food is Medicine program takes home a bundle of fresh produce.
Mimi.
Back in the teaching kitchen, the chef's amped up show and tell entices even the youngest chefs to pitch in.
It's time to Lego my ego. Who wants to crack some eggs? Me! How did I know? So for French toast, we're gonna use something really, really simple. French bread. Does that make sense? All right, here we go. We're gonna go in, dip, baby, dip. All right, and down we go. 1, 2, buckle my shoe. There we go. Who's cooking sausages?
Next up, a breakfast staple, minus the heavy processing and additives.
At the restaurant, we only use chicken thighs, but this one's gonna be a mixture of thigh and breast. Take a scoop, drop it like it's hot. Let's go to the skillet. To the skillet!
Nothing on here is unpronounceable.
Because if you pronounce it, you can make it. Because you ain't got to go into the store trying to find xanthan gum.
So how do you guys feel about what you made today? Good? 2 thumbs up.
I learned just like, okay, I don't have to put all this salt in the food to cook it.
After more than a year of monthly classes, Ashia Smith says her blood pressure has stabilized.
To be able to stop having to take blood pressure medication, that's a big deal.
It's a big deal. It really is. I got a young son.
Yeah.
It's my youngest kid. So we want to break the cycle.
Right there.
You are instructing people like me who don't really know their way around a kitchen to cook better. What are you getting out of that?
I want people to live better. How you eat determines how you live. Period.
We continue looking at how people are taking steps to make healthier food choices. A rooftop garden in Brooklyn is offering familiar vegetables to limited-income Asian immigrant community members. Here again is Adam Yamaguchi.
Across New York Harbor from the Statue of Liberty, this rooftop farm offers immigrants a taste of home. Residents shop for vegetables at the Brooklyn Grange Weekly Market, part of an effort to improve the health of older Chinese Americans in the Sunset Park neighborhood.
There are lots of packaged and processed foods within the Asian food system that are built around cost and convenience, just like in the American food system. These are cucumbers.
Dr. Stella Yee is an associate professor of population health at NYU Langone.
There is a myth about Asian Americans being healthy. When it comes to obesity, Asian Americans are always the lowest obesity prevalence, but when you actually start to look at some of the outcomes at smaller body sizes, Asian Americans tend to be at equivalent risk for some of those cardiometabolic conditions as other racial ethnic groups.
Dr. Yee partnered with the Brooklyn Grange to offer subsidized, heart and gut healthy local produce.
So for the older Chinese Americans who are on limited incomes,
Yeah.
what is their access to foods, healthy vegetables?
New York City does a great job of having this really robust charitable food system, but the products are not necessarily culturally appropriate. There are things that are being left behind, like canned tomatoes or acorn squash. It's not because they're ungrateful or because they don't need it, it's they literally don't know how to prepare it.
The Grange harvests bok choy, Chinese broccoli, and Asian eggplant, and other crops that help John and Vivian Kwa add more vegetables to their meals.
Tell me about the vegetables and what you think you're going to do with these.
Zucchini, we usually do it on the barbecue and cut it in half and then use soy sauce and then some salt. It'll be delicious.
My sugar has dissolved.
At a pickling workshop, Winnie Kwan learns how to preserve varieties of vegetables familiar from her early years in Hong Kong. Kwan is active and health conscious, but like so many Americans, succumbs to cost and convenience.
You've been here for 30 years. Do you think that it's become easier to find junk food?
A lot.
A lot of junk food.
A lot of junk food, yeah.
It's hard to avoid junk food.
Back home, Kwan prepares herself a healthy feast of shrimp with cucumber and curried chicken with potatoes.
I eat slowly and enjoy it, but I eat a lot. I eat a lot.
It's not just about access to bok choy or various types of produce.
Yeah, exactly. It's like one bite of food you can transports you back to being like a 5-year-old kid. I really wanted to try to capture some of that for the folks that are participants in this program, to say how great is it that they're growing it here in Brooklyn for me.
A community now firmly grounded on American soil, planting the seeds for a healthier life.
Ahead, why an increasing number of families are juggling raising kids and caring for their own parents. That story is next. We close our show with a growing concern regarding our nation's aging population. An estimated 10,000 Americans will turn 65 every day between now and 2030. This large increase of elderly Americans has many experts worried about our country's ability to properly care for them. Lisa Ling introduces us to her family, part of the so-called sandwich generation, and explains the challenges that they and others are facing.
Mornings in our home are pretty hectic.
She said there was a mistake on the study guide.
My husband Paul and I travel a lot for work. So usually just one of us gets our two girls off to school.
Ready?
But today, Paul has to rush back to take his 92-year-old mother, Grace, to doctor's appointments.
Is it cold outside?
No.
It's been a tough couple of months for her with multiple trips to the ER and rehab facilities.
That's the main hospital.
We are part of the nearly 80 million Americans taking care of children as well as our elderly parents at the same time.
Step up.
And we have a name, the sandwich generation.
At a certain point, your parents become like kids.
Lauren Shin is dealing with something similar. Until recently, she had both of her parents living with her and her husband while raising two young kids.
When did your parents move into your home?
They moved in 2017 when my first child was born. They came to offer to stay with me for a year to help raise him, and then their health started to deteriorate, so I said, "You're staying. I'm going to take care of you."
It was during the pandemic that Shin realized it wasn't just her mom's physical health that was starting to deteriorate. It was her mind.
Tell me about how her behavior changed and how the mom that you had always known really started to change.
In the first few months, it was still okay. It was just seemed like a lot of nonsense talking from her. But then there was a switch. She would tell me to shut up with profanity words sometimes. She would look at me as if she could kill with her eyes. And I would say something and she'd be like, "You don't know what you're talking about."
3 years after moving in, Shin's mom was diagnosed with Alzheimer's disease. Alzheimer's disease can lead to delusions and sometimes violent behavior. This makes care very difficult. At first, it was Shin's father who took it on.
He was spoon-feeding her, he was sitting next to her, he was talking to her all day. There was not a moment that he wasn't by her side.
After 2 years, her mother's condition continued to decline. But it wasn't until Shin gave birth to her second child that she knew something had to change.
What were those first few months when your daughter was born and your mother was still living here and going through the height of her disease?
It was hard. I was trying to heal and take care of a newborn and a 6-year-old. So it was a lot of nights of screaming and crying into my pillow. Hi, Lisa.
Shin's family decided that it would be better and safer for everyone if her mom could move into a memory care facility. They found what they were looking for an hour away in Anaheim, California, where the majority of the residents are Korean American like her mom.
Do you know how she's been doing here?
She has actually adjusted a lot better. The first month or two was hard. I heard she was screaming for my dad. And then a shift happened, and they said this would happen. And she met some friends that she always hangs out with and sits with and eats with.
Shin was able to pay for her mother's care through California's Medicaid program called Medi-Cal. It's for individuals with little to no income. But in many states, costs for memory care facilities can exceed $10,000 a month out of pocket.
Medicaid is a state and federal joint program. It's complicated, which I sometimes think is by design.
Nicole Jorwick is with the organization Caring Across Generations. She says most Americans should not expect that Medicaid will cover facilities. She says its wait list is over 750,000 people long.
States can limit how many people they're going to serve. And also the federal government has limits about how much money people can have in order to receive those services. So Medicaid really requires people to spend down their assets and remain in poverty in order to access long-term care.
Okay.
So far, we've been lucky that Paul's mom has been able to stay in her home with her kids keeping close eyes on her. My own father spent his final days in a facility that he paid for with a government pension and what he had in the bank. He passed last November, but had he lived, his entire life savings would have lasted him a maximum of 2 years. Shin and her family are grateful to have found a safe place for her mom. But as a sandwich caregiver, Shin still has young kids and an aging father at home.
Is there anything you would want to say to all of those out there who are struggling and juggling, taking care of their kids and taking care of elderly people as well in their lives?
It does get better. The kids will get older, they will become a little bit more self-sufficient, and they won't need you as much. And the elderly, I just want people to know they don't want to be the ones needing help either. And this is my turn to give back for all their hard work.
For more stories like these and live coverage of breaking news, stream us right here on CBS News 24/7. I'm Michelle Miller. Thank you for watching Eye on America.